Recording.
Hi there. Can you guys hear me?
Good
Yes, hello.
Good morning.
Morning.
Hi.
Morning.
Boy,
Morning.
is anybody else
Sorry,
having issues with Zoom this morning?
I was too. That's why I'm like, oh no.
Yeah.
Good morning.
Yeah. Good morning.
Good morning.
Oh, okay. Did you guys start without me, or is this our first conversation?
This is our first conversation, and there's still people jumping on.
Great. Okay.
And we had a meeting, a different meeting this morning. So for some individuals, Julie, they have been meeting with us for one reason or another since 9 o'clock.
Oh, so everybody's really tired. I'm the only thing between you and a coffee, right?
No, I think they'd rather hear from you than me earlier. So.
All right, good. Well,
So
how much? Go ahead.
I'm sorry.
No, I just wondered if we're going to wait for a while to keep allowing people to arrive, or.
I'm not sure how many people from Choices are on the call, but last I checked, we had about 65 people who indicated that they were going to accept the invite to join the meeting. But if we could get started and have people, if you don't mind changing your name in the on the tile so that Julie can reference a name if you guys have questions or. And
Yeah,
if you're not aware how to do it, if you hover over the top right corner, there's 3 dots. If you click them, it'll allow you to rename yourself. So a first and last name would be helpful. And so Julie, just so that everyone's aware, we did send everyone the manual as well as instructions, and just referred people to the website to learn more about it prior to coming. So everybody should be at least somewhat knowledgeable. And some folks may very well already be in the network, but are just interested in hearing more about what the opportunities might look like.
Okay, that's terrific. And you sent the CMHW manual?
Yes. Andrew, wasn't that the one? Yes.
Okay, just want to make sure, because I know we those terms CMHW and CMHI sometimes are used interchangeably, and I just want to make sure that you're all aware this is about the CMHW program, the Medicaid funded CMHW program.
Absolutely. So I will hand it over to you. I don't know if you would like everybody to introduce themselves or if you just want to take the floor, but we do have maybe 7 people-ish or so that are Choices employees. So Beth and folks from her team, and then individuals from the provider relations team.
Okay, hi. And by the way, I just wanted to put a special shout out to Alan. Hi, Alan. I see you down there. Okay, well, I think a lot of you probably know about it. I want to say that we released a webinar yesterday on changes that are upcoming to the CMHW program. And so I just want to put out there up front that I'm not going to be responding to any of those upcoming changes today. But you can submit any questions or comments to the youth services inbox, and I'm going to put that in the chat right now. If I can type it out. Okay. Oh, wait, that just went to Alan. Sorry, Alan. But I would like to field some of your questions if you guys have any, or if you would prefer, I can just give you the overview of the CMHW program and tell you how to get enrolled and what our needs are. And make sure you take yourself off mute.
That's perfectly fine. So just to repeat what you said, Julie, you're opening up for questions that people might have after reviewing information or hearing otherwise.
Yes. Does anybody have any specific questions? Or if you would like for me to just launch into the program and how to become a provider, start voting in the chat box, please.
Hi, I have a question. It's Marlene.
Hi, Marlene.
Really quick. So if I follow all the procedures that you share with me, how long is the process for a generally small agency to get enrolled?
It's a good question. A lot of it depends on the completeness of the application, which I think is what you're getting at. If you follow all the instructions and do everything properly, I would say about a month. Sometimes it could happen more quickly, but that would mean you get your application in, we get it processed and turned around back to you. Then you go to Medicaid and complete your enrollment, and you get the proof of your enrollment back to DMHA. We activate your enrollment and you begin to appear on the pick list. So I would say 2 or 3 months can be more realistic. Now, the one exception to that would be for facility-based respite, because I process those, and so I can process those more quickly. Otherwise, they have to go through the regular provider coordinator.
Thank you. Okay, so to my understanding, also based on your answer, we would register or enroll with you first and then then go to Medicaid as a provider?
Yeah, that's right. So the CMHW program is operated from DMHA, and it's funded by OMPP or by Medicaid funds. And so what we have to do is let Medicaid know that, yes, this person meets the requirements to provide that service line, because it's not like being a doctor or a therapist or something where you go through licensure. You know, you have to go through DMHA to get that authorization. And what you'll do is once you receive your authorization letter from DMHA, then you'll take that letter, and that will be your ticket to be eligible to enroll as a CMHW provider with Medicaid.
Thank you.
And something that's different about our program, many of you may already be aware of this, but we don't just authorize an agency and then that agency trains and hires. You have to send each one of your staff through training. We authorize every individual staff person who becomes a provider in our program.
That's what was my next question, and that's what stopped us before, because of the content, the information, content, whatever. And I'll just keep it like that. So that's my question. Is it still the same where you don't necessarily authorize an agency, but each individual person?
Yeah, the authorization for the agency flows up from the individual. Now, what we have, so the first hurdle for most of our for all of our providers is that they have to submit a resume to us demonstrating that they have the appropriate experience. And then we say, yes, you do, and register for training. Now, these training events have always been, I think, these necessary evils where we want to have these trainings. We have to make sure people understand the program, but they happen intermittently. They're all over the place. You send your staff there. They may or may not pass the test. I'm happy to defend having people not pass the test, not be eligible for the program. But it's really hard to hire if you've got a good candidate and there's not a training event for another 6 weeks or maybe 3 months. That's a real problem. So what we've done is we've made some changes to training recently. The training is over the provider manual, and we are having one a month. We may not have one for December and January. We may or may not, depending on how many resumes we get. But currently, we're going to have a monthly training event that happens at the downtown office. If you have a lot of people, well, you can come to you. If you have, like, I would say at least, we'd like to say 20 to 25, but if you had 15, I would come to you. The test generally takes about 2 hours if you've studied the manual. And if you don't study the manual, you're probably just not going to succeed. And you don't have to like study it, have it memorized. You have to read through it once so that you have a high level of understanding. And then you have to know, so you have an idea of what is in the manual, so that when the question comes up, and the questions on the test are broken down by the section. You don't have to flip around to different sections. It's section 3, section 4, section 5. And so if you've read the manual and you've prepared prior to the training, you should be able to go to that section and take that and answer those questions. They're not trick questions. So a couple of them do require that you apply the standard, so that if, for example, you're a provider of training and support for the unpaid caregiver, you have to be able to understand who is and is not an unpaid caregiver, because when you're in the field and they ask you to provide training and support for someone who's not eligible, say it's the youth pastor, you may need to say, is the youth pastor paid or not paid? Is that a volunteer youth pastor, or is that someone who works for the church? Because if they are an unpaid caregiver, they're eligible to receive that training that can support that youth. If they're a paid caregiver, they're not. And so there's some questions, but that require that you think in the ways that you will have to think when you're a provider. But a lot of it are just rules straight out of the manual. And we also do allow people to miss 2 questions, and they are allowed to come back and take the test again if they don't pass. So that's what's happening right now with our HAB and FST classes. Now, respite services there's a webinar for that is available online. You can send your staff to sign up for those and submit their applications and get that ball rolling really quickly. If you decide to, as an agency, to have respite, FST, and HAB, the fastest way to get through the enrollment process is to go with respite, have your staff sign up for the home and community-based respite program, take those trainings, and get that application into DMHA. Once you have your letter, then you can proceed to enrollment with Medicaid. Then when you add staff later on for HAB and FST, you don't have to go back through, well, I guess you do for enrollment. But we would allow you to go ahead. You might have to hold, you'll still have to enroll staff as rendering providers, but you can hold your billing. We'll go ahead and activate you on activate that staff person on the pick list, and you can get them working. It is always the agency risk that for some reason Medicaid wouldn't authorize that person. But I would think you would have cleared all those hurdles with your criminal background checks and things like that already.
Well, thank you so much for all that information. It was really good.
Yeah, you're welcome.
Julie,
Hi, Miss
I have a
Julie.
quick question for you.
Oh, sorry. I'll let her talk.
Oh, sorry,
Okay.
Felicia.
It's
Hi,
okay.
Julie.
Go ahead.
My one question, when you said the monthly trainings, are you saying the monthly quizzes essential, or the monthly
Yes.
tests? Okay,
Yes.
just so I
Yeah.
understand. So it's they'll do the manual, like I understand, and then they'll sign up for that monthly test essentially.
That's right. That's
Okay.
right.
Okay.
Yes,
My
Felicia?
question, the webinar that was released yesterday, will that be sent through the mailer that we get when there's a normal update? Should we have already received it?
When there's more information about that, you mean?
Yes, you said you
Yeah.
did a
Yeah,
webinar.
the announcements will be made. Announcements will be made through the system of care mailing list.
Okay.
Yeah,
I just wanted to make
so-
sure I didn't miss anything. I was looking for it when you
Yep.
said that.
we've got a lot of good questions already. If you have any questions or concerns, get them submitted to the System of Care mailing mailbox sorry,
Okay.
not System of Care, Youth Services, the FSSA Youth Services mailbox. And I put the address in the chat. So if you scroll up, you can find it. I'm sure most of you already have it. And we'll respond to all of those questions as a group.
Okay, but the webinar has not been sent out yet. Is that correct?
The webinar, the link to the webinar was in the email that was sent out.
Okay.
Yeah, so it's available.
Okay, thanks.
Sure thing. And it's also on our announcements page too.
Hi, Miss Julie. This is LaShawna Triplett. It's the process, and I joined the call late, so you might have already addressed it. Still send you the resumes and get that. And
yes.
You send back approved,
yeah, we'll
are denied, and go through that process. Okay.
Yes.
Thank you.
Yes, and I know that I have so I have several resumes that are in the my file for review, and I'm going to begin doing that on Monday because we've had a report that's been due to the federal government we've had to do all week. So if you want to get your resumes in, we have a training scheduled for the 20th. I'll go ahead and give you our next training dates. So the next one is September 20th. Let me open up my calendar and make sure I get this correct. We have training dates scheduled for September, October, and November. So for September, it's going to be the 20th. That's a Monday, and it'll be right in the middle of the day. There's plenty of room in that one. So if you get your resumes in, you can attend that one. For October, the training is going to be on the 18th. And I'm saying training, but basically you're showing up to take a test. So, and then in November, it is the 15th. November 15th. So get your resumes into me. I'm going to begin reviewing them on Monday. For those of you who are agencies who are sending me your staff resumes, the fastest way to get them reviewed is to make sure they have everything I need in them. To describe the experience that they have so I can tell whether or not it's qualifying. Make sure that you include the month and the year on your experience list. Anything that's not related to working with youth with SCD, I don't really care about. It's not that it's not important to you, it's just not important to your qualifications for this program. You know, as agency owner, I'd hope you would vet those resumes so I can rely on them. Then when you submit those resumes, it's also much faster if you submit them one resume per email, put the applicant's name in the subject line, and copy the applicant. That way, when I review that resume, I can simply reply all and let both of you know, yes, this resume is approved for training, or no, it's not. If I have a big cluster of them, it takes a long time. And I'm doing all of this, like pasting it to the Excel spreadsheet and putting it over here, and then dates change. And so it can get messy if I have to do too much moving around. Somebody might not get their invitation. My top priority is keeping that list of people who are authorized up to date, so I can always look and make sure, you know, that person's authorized. That's not where we end up falling short. Where we end up falling short is they say they want to attend one training, they change their mind, they do another one. I say, yes, that should be fine, but then they don't get the invite. So the more streamlined we can make it from the very first submission, the faster it all goes. And it isn't a problem if you need to reschedule, but we do get a lot of people who just no show. So if you sign up for a training, please attend. And if you can't make it, that's okay. But don't sign up thinking if I get the day off, I'll go. And if not, I'll just let her know and reschedule, because that kind of takes the spot away from somebody else.
Hey, hi, Julie. This is Michael Clark. Got a quick question, and this might be this submitting an application for an unaccredited agency. Submitted before, but I think the filters caught a lot of the attachments because they weren't PDF. But I want to submit again to be approved and then go get the Medicare number. I've already got the HAP and the FST and everything certified. Is there a contact person that I can work with to kind of review that packet before I submit, or is there anyone that can assist along those lines?
Well, as far as sending it through the filters, we have to be really careful because we are, we have a lot of highly sensitive data in our database, and our filters are pretty robust. So, and let me say this let me digress just a quick second to say this about your resume submission. Don't send me a link to Google Docs because I can't do it. It has to be an attachment.
Right.
About having someone who
this
will
will be
sit down and assist you and look at your packet to look at it for completeness. Sometimes Olga Murray will set up a meeting with you and you would need to do that virtually with her, where you share your desktop and she can look at it. But I want to tell everyone, in case you haven't heard yet, that Mrs. Murray will be retiring. She's about to send out an email.
Wow.
I'm spoiling her email right now, so we'll get that sent out today. It's coming out through the mailing list. But yeah, so she doesn't really have a lot of extra time right now. She's really trying to get everything put together. So don't be disappointed if she isn't able to make time for you. She will do her best. But we send you back a list of the things. She has put together a checklist that will tell you everything that needs to be in there. So if something's not getting through the filter, that's not a checklist problem. That's, could be a problem with the integrity of the documents. I'm not sure.
Okay. Just quick, is there a way that I can submit a hard copy where I could just walk it into the office and?
Oh yeah, I think that should be okay. Mail it to the youth services team. Mail it to the youth services team.
Okay.
Yeah, there should be a mailing address on your paperwork somewhere. Do you have that? If not, I can give it to you, but I think it should be on those.
I think I have the downtown address.
Yeah.
If it hasn't changed.
It should be
the one that's on the checklist.
Yes, then that should be fine.
Yeah,
just send in a hard copy of that and that should do it for you.
Okay, perfect. Thank you.
Julie, I have a question. This is Amaryllis Lewis. How are you?
I'm well, thank you.
Yeah, good to see you. I am already a CMHW provider for HAP and FST. If I wanted to add respite, where can I find that information? First of all, are you allowed to add a service after 3 years?
You sure can. What you'll do is, first of all, you always go to your provider manual.
Mm-hmm.
And then if you have the resource guide, which is on the provider information page, there's a resource guide, and Mrs. Murray has created in there a section that tells you how to add a service.
Okay.
And so, but what you would do is you would create, if you look on your application forms, it'll tell you add a service, and then you submit it kind of like if you were submitting your original, your original information.
Mm-hmm.
You'll still have to send in your updated insurance card and all of that information, along with your certificate from training. I don't know if you have to send in an updated provider agreement. So yeah, check the resource guide that Olga has put together for you, and there should be instructions on that specific activity.
Thank you.
You're welcome.
Miss Julie, this is Lashana Triplett again, and I have a question. When you were talking about the resumes and what kind of on your resume that may, you're really just looking specifically for the experience in working with the youth. So as a choices provider, if I'm redoing my resume specifically to just what I'm applying for, I would list choices. Would I list my my choices provider's relation person for that reference, or would I list the care coordinator for that reference?
What I'm going to be confirming are the dates of your employment. So you're going to need to include that information. Who is going to be able to confirm your dates of employment? Generally speaking, that's your human resources department.
Okay, great. Thank you.
Mhm.
Hi, Julie. This is Jennifer Murphy. How are you?
Hi, Jennifer. I'm well. How are you?
Good. So I have a question. So I heard that you're, certifying new providers and bringing people on, I guess, potentially monthly. Is there that type of need still here in Central Indiana?
I'm really glad that you asked that because I do want to be honest with all of you and tell you that we have about 30 pages of habilitation providers in the Marion County area on our pick list. There's a bunch of you out there. It doesn't mean that there's not always room for another provider, especially if you're a good one, because there's, we always need those types of providers, or maybe if you have a special method or technique that you use. Some people are rec therapists or art therapists. That's something sort of different that we don't have as many of. Or if you're bilingual or sign language, those are always things that make you really valuable. But I don't want to mislead anyone into thinking you could definitely apply and not be selected because we have so many providers. So some of the things that help are going with a reputable agency, because a lot of times families will feel, oh, they recognize that agency name. And that's one thing that can help you out. You could look around. Some of the more remote counties are really hurting for providers. So if you're in the Marion County and Donut areas, you got a lot of competition. If you're in other areas of the state, they're really hurting for providers. I mean, Evansville, I think, has one provider, and that's a bona fide city. I mean, Evansville is a no joke city, and they really don't have any providers down there. Not to mention other areas like Columbus, Bloomington, Fort Wayne has a few providers, and they stay very busy. Lawrenceburg, Gary, and Crown Point, all of those places need providers really badly. So if you are at a decision-making place in your life where you're willing to relocate, that you could definitely do this. You could definitely have a caseload. Terre Haute is another area where we don't have hardly any providers. Richmond, I mean, these areas, there's just not. So, do you want to stay in Marion County, which I understand, wanting to do that, but you could have a lot more business and a lot more comfort in knowing that you're making a wise investment if you were to consider moving into some of these other locations. And if you're already in those other locations, I would strongly encourage you to enroll. Some areas where we definitely don't have, another area in Marion County where we don't have enough providers are those hourly home and community-based respite providers. We can never have enough respite providers. It's a service the family needs. I know everybody wants to go after that big money for the HAB service line, but I want to tell you there's a lot of responsibility that goes along with that extra money, and a lot of providers struggle with that. And it's a lot to do on your own. If you want to be an independent provider and provide HAB and FST, you are really taking a lot on your shoulders because there's a lot of administrative oversight that is required to provide those service lines, arranging for your supervision, tracking for your supervision, not to mention reading all the bulletins that come out that apply to you. Whereas respite is pretty easygoing. Like, let me give you an example. I know a lot of you work as like mentors, okay? And if I want to tell you now that HAB in the CMHW program is not mentoring in the common way that you may be thinking of it. If you think you're going to pick up a kid and take them to the ball game and coach them on their social skills while they buy a soda pop, you're kidding yourself, because that is not what HAB is in the CMHW program. And if that's the activity that you do, you'll have to pay that money back. And that's the kind of trouble you can get into going out on your own as a HAB provider. That would be service. So daily living skills, that's not HAB in the CMHW program. That's what the MRO providers are. And I don't know if maybe some of you don't know what MRO is, but for children and adults who are on Medicaid, they can receive mental health services through their local community mental health center. And those services are called Medicaid Rehabilitative Option, or MRO. And so because those kids in our program are already receiving MRO services 99% of the time, those daily living skills, those organizational skills, things like going out and working on the grooming, hygiene, that sort of thing, that is done through MRO. What we want HAB providers to do in the CMHW program is work on those social, emotional, decision-making skills. So if you were to work on social skills with a youth in the CMHW program, it wouldn't be on day-to-day manners of saying please and thank you. It would be that this kid has crippling anxiety and they are unable to function in school because they can't bring themselves to ask a teacher for assistance or to give a presentation in front of the class. And so you as a HAB provider might go in and work with them on how to cope with their anxiety and how to be able to address those needs that are really painful for them in that school setting. That's what we're talking about when it comes to HAB. So on the other hand, respite is fun. And I think that the families need that. I mean, a lot of the kids in these programs, in the CMHW program, are programmed to death. They're programmed through DCS, they're programmed through juvenile justice, they're programmed through the school system, they're already programming through their MRO services. What the families and these kids often need more than anything else is what most of us need, which is a break, just a break. And respite is more fun. Respite is where you can go out and do what you like, and you're not restricted to that 3 hours a day either. You know, you can go out for longer blocks of time, which as an agency owner means that you're not paying for all that non-billable time on either side of the activity. HAB and FST providers are required to attend every meeting, which occurs at least once a month. Usually it's monthly, it's pretty steadily monthly. You're required to attend that and you don't get to bill for it because your attendance is already figured into the rate. So we like to say, don't think of it as you're not getting paid, think of it as you've already been paid when you provided the service. So, but respite providers, unless they're requested to by the wraparound facilitator, don't have to attend those monthly meetings. So it's just an easier service. It's a more fun service. It doesn't pay as high as HAB. We are working on increasing that. We got a better than 50% rate increase. It'll probably be 2 more years before we can get the rate increased again, but we're looking at trying to push it up as high as $50 an hour. So I would strongly encourage you to become a respite provider. It's also another way to get your reputation established in the field, and that's always helpful.
Hi, Julie, it's Tawanda. There are some questions in the chat, some of which you may have answered. If you'd like, okay, I'd be happy to read those, or we can wait till the last.
Could you go ahead and read those questions to me as they come in? That would be helpful to me.
Okay. So the first question is, if we're interested in the CMHI program, do we complete DMHA's training? And then do we have to supervise employees under our agency?
Do you have to supervise employees under your agency?
Do you have to employ a supervisor under the agency?
Oh, is that what? Okay, I'm sorry, Kim. But the first part of it was, you know, if they're interested in the CMHI program, do they have to complete the DMHA's training?
If you want to be, my understanding is that eligibility to be a provider of CMHI services is contingent upon your authorization as a CMHW provider. So yes, if you want to do the CMHI, you're going to have to be authorized for the CMHW. And that would mean completing your enrollment with Medicaid and actually working with the CMHW program. Because if you just get your authorization and then you don't complete your enrollment, you won't show up on the pick list, so that they won't be able to verify that you're an authorized provider. And also, if you don't enroll in Medicaid, after a year, we deactivate your certification, and then we communicate all that to DCS and let them know that this person is no longer authorized. So you do have to, you do have to do both. And then every provider of HAB or supervision, HAB or FST, is required to have supervision by a licensed mental health professional 1 hour for every 30 hours of services provided. So if those are your employees and that's your agency and you're the one who's receiving revenue, then it would be your responsibility to ensure that that supervision occurs.
And I think the question also, Julie, is that the second part of it is, do they have to employ a supervisor under their agency, or can they, I'm assuming, contract with someone outside of their agency for that supervision?
Yeah, well, today that is completely up to you. There are forthcoming changes in the CMHW program that were announced, and that you can find a webinar. We kind of wanted to give everybody a heads up on some changes that we're going to be making, so that we could kind of get the word out, not take anybody by surprise, and give them plenty of time to start thinking about what they want to do. And so that's one of the changes that's coming up, but I will refer you to that webinar. And if you have specific questions about that webinar, you can submit your questions to our DMHAU services inbox. And I believe the email address for that is in the chat.
It is.
So yeah, you can take a look at that, so that if you're initially getting set up, you know the direction that DMHA is proposing to be heading in.
Okay, thank you. And then the next question is, do the providers have to take Medicaid in order to apply for this program?
Yes. So when you apply for this program, that's who pays the bills. So you're going to apply to us first, and then you're going to enroll in Medicaid. So it's fine for this to be the first Medicaid service you've ever provided. You will complete an initial enrollment with Medicaid after you've received authorization from us. If you're already an authorized Medicaid provider, you may not be authorized for this service. So you would still need to go through us to receive authorization to provide this service line.
Okay. And then another question is, are the trainings in person? And I believe you did respond to that or answer that.
Yeah, what we are calling it a training, but really it's a test. And so they are in person. What happens is, when I approve the resume of your staff, I'll send them an invitation to training, and I will also, I'll send them dates to select for training. They'll let me know which one. And then when I send them their invitation, I'm going to send them a copy of our current provider manual, which is available to you at any time. You can get that now if you wanted your staff to start a group study or something, but we would want them to read the manual. It's a good idea for them to just read through the manual at least once, and then maybe focus on the areas that they want to, of services they want to provide. The day of the test, they will come in, they'll sign in, bring a pen and or a pencil, and then we will hand out the test. Testing will begin promptly at the time assigned. I think right now, let me look and see on that calendar when that training is. But anyway, we will begin testing on time. And I think we're giving 3 to 3.5 hours for people to take the test. What we have found is that people who have studied ahead of time and are familiar with the manual are able to complete that test in anywhere from 90 minutes to 2 hours. And that people who haven't studied at all generally have a really hard time finishing and usually don't pass. So I would just be honest with you about that. When they take it, it'll be a written test. It's all either multiple choice or true false. And you can miss up to 2 questions and still pass.
And then someone wanted to confirm the October meeting opportunity, which is October 18th. And then what if you were already an MDCD provider before taking the training test?
If you were already what kind of provider?
It says MDCD, provider
Medicaid.
before.
Oh, just
taking-
Medicaid. Alan, you know I can't handle your abbreviations.
That's a friend's, not mine, but I just helping out there.
Okay.
Oh, okay. Thanks. Jumping in. Okay. Now I need to hear the whole question over again. I've gotten lost.
So if you're already a Medicaid provider before
Yeah.
taking the training test, what
Yeah.
if you're already a Medicaid provider?
You'll still have to have this particular service line added to your Medicaid enrollment. So
Okay.
I don't know what you're a Medicaid provider for.
Okay.
If you're already a CMHW provider, so I know that I can't remember who asked, but they were talking about adding a different service. So let's say you do FST and now you want to add HAB. In that case, because you're already a CMHW provider, once you add that extra service line, then you wouldn't have to go back and then re-enroll in Medicaid. Okay, we don't enroll the subspecialties in Medicaid. We control that through our database here in DMHA. And I see that Deidre's had her hand up for quite a while.
Oh, I'm sorry.
That's okay.
Hi, Deirdre Lloyd. Good morning, everyone.
Hi.
So that was my question because I am a Medicaid provider for therapy.
Okay.
And I took the test as an individual, but I'm looking to get the agents. Well, like you've explained that each person would have to go through. So I have been working on my application and doing what I need to do as far as trying to get the, I guess, people approved through the agency.
So you can start, Deidre, you can start by forming your agency and having yourself as the first employee. If you want to get the ball rolling, you know.
So the agency is established.
Okay.
The agency is established. I'm a Medicaid provider, have been for a few years now. And I have therapists that work with me. So we provide therapy. I personally just took the test to become the CMH provider. So I passed the test and I'm doing the application now.
So you're enrolled as a type 11 mental health provider. And then I'm not sure what your specialty is, but is it like outpatient mental health or?
Yes.
Yeah. Okay. So that's like, I think that's specialty 110.
Yes.
So type 11 mental health specialty 110.
Yes.
For our program, it's type 11 mental health specialty 611.
So would I go in? So after I get approved with you all, would I go in and just kind of update my services to add that service or that provider? I can't remember the exact term, but I would just go in and just do that.
Are you currently enrolled as a group or as a billing provider?
As a group.
You're ahead of the game. So yeah, you'll go into your group enrollment and then you will add the 611 specialty to your group enrollment. You'll add it to yourself as a rendering provider as well. So you're going to be enrolled as a rendering. Right? And so then you will add, so you want to add it to your group and then you want to add it to your rendering enrollment and link yourself. Obviously you're already linked to that group. And in place of your license, we have a whole workaround. It's a total nightmare and I do apologize for it. It's one of the things we're looking to fix as we go forward in the program.
I got these applications and I have so many questions because I kind of got stuck on, I wasn't quite clear on what my next steps were.
Yeah, so if you've completed training and you submitted your application packet to DMHA and received a letter?
Not yet, because I wasn't sure which one I have to, because I found like 3 or 4 different things. Like there's a cover letter and there's 2 different applications and now you've been talking about respite. So now I have some other things you put on my mind. So
yeah,
right.
That's correct. You'll have to have that authorization letter from us to have that for Medicaid to allow you to have that specialty.
Okay, great. Thank you.
Thank you.
And then the next question is, what is the current respite rate?
I won't think I know it by heart, but let me pull it up here just to make sure. I believe it's 26 something an hour. here we go. Of all the things I had pulled up, I didn't pull that up. Here we go, rates. And if any of you are associated with emergency shelter care or group homes, we would love to enroll you for facility-based respite. We have a big need for that. So the rate for respite is currently $6.09 a quarter-hour unit, or what does that come to? 24.36 an hour, 24.36 an hour.
Okay,
And then you flip to the daily rate at 10 hours. So if you provide 9 hours and 45 minutes worth of respite, you're going to bill that at the hourly rate. But once you hit 10 hours, then you're going to flip to the daily rate. And the daily rate is for routine respite is $243.77.
Okay.
So it's kind of a nice thing if you have somebody who maybe wants to work every other weekend. I know when I was a single parent and had every other weekend off, this would have been a really nice job for me to have, you know, so they could take, if it's what the family wants, take a youth out for the day, you know,
Okay.
on the weekend, something like that, and get that full 10-hour block in.
Okay. And then another question was, how do you become a respite provider? So is there a...
Okay. Yeah. So it's, one of the things I'm going to do while we're on here is put a link to our manual online. And let me do that now. Copy. Here's our manual link.
Okay. And then while you're doing that, Julie, someone else wanted to know, how do you find out who are facilitators in different counties so you can let them know that you provide HAB or FST in their area?
Yeah, that's a good question. So I'm also putting on here the link to our provider information page, and on that, so let me finish this real quick, and then I'll return to that question. On that provider information page is where you will find forms for application, the resource guide that tells you, that kind of baby steps you through the application process, and the webinar for becoming a respite provider is also on that page.
Okay.
And then could you repeat your last question?
Yeah. How do they find out who are the facilitators in different counties so that they can let them know that they provide HAB or FST?
Well, generally speaking, although it's not always the case, but most of the time it's the community mental health center in that area. And you can ask them for their wraparound facilitation supervisor. You can send an email to me and you can ask me if I'll look it up for you, but you might wait a minute because it's, you know, it might take me a few minutes to get back to you before I can give you that pick list. But you are definitely, you can talk to your system of care coordinator on our access site list or on our pages. If you go into access, a lot of the places that are doing access are also the wraparound facilitation provider. So you can, if you don't want to wait to hear from me, that's another way you can get it. But anybody who has access to a pick list can run the pick list for the wraparound facilitation providers in your county, including me. And I want, some of the wraparound facilitation providers are unsure whether or not it's solicitation when you reach out to them. So we've been trying to let them know that, you know, solicitation is when you approach the family. Solicitation is not when you approach the wraparound facilitator to let her know, hey, we're providing services in this county now. So I'll always have your back on that, and you might want to let them know that DMHA told that you could do that. But it's what I would do, particularly if you're going to an area where there haven't been providers of one service or another. Families sometimes quit asking, the facilitators quit talking about it because there's nobody to provide the service. So if you're, particularly if you're providing services in an area which has scant resources in that, when it comes to providers, I would be sure to contact the wraparound facilitation agency and let them know that, you know, hey, I'm open for business.
Okay. And then thank you, Julie. They also asked for your email address to submit resumes. So
okay, I can give that. I will give you my email address, but we want the resumes submitted to the youth services inbox.
Okay.
And that way they don't just end up buried in my email, because I want to be honest with you guys, it's a busy time of year for me, and I currently have 883 unread messages in my email box. So if you put them to the youth services inbox, they're less likely to get buried.
Okay.
But I will give that to you. I'll give you both. So it's julie.bandy@fssa.in.gov. And I'm going to give you that youth services. Oh, I keep sending these messages directly. I don't know why that happens. I'm not sure what I'm doing wrong. And for respite, I will also have to approve your experience for that too. It's only 1 year of experience for respite. For those agencies who are coming on board, it's a good place to bring your folks into the system if they only have a year's experience, and allow them to get to know the system, and you get a good look at them to decide whether or not you think they'd be good at having FST or what their strong suits are.
Okay. And then another question was just for clarification. So for the CMHW, the process is step 1, complete the application. Step 2, submit resumes. And then step 3, send approved applicants to training.
Step 1 is send me your resume.
Okay.
Step 2 is approved people with approved resumes will be invited to training. And then in step 3, you would take that, then you submit your application, because we don't process incomplete applications. And if you have not successfully completed your training, you won't be able to submit a complete application.
Okay.
So yeah, the first step is send me your resumes.
Okay. And then the manual, that link has been placed in the chat for someone, for everyone. But then the next question is, how many questions are on the test, if you could share?
103.
103. Okay. And then there are a lot of services that I would like to learn about. Who can I speak with to learn more about services and programs that my agency can apply for?
Are you talking about within the CMHW program or just
Yes.
generally?
I believe CMHW program.
Well, the first thing I would do is I would start by looking at the manual.
Okay.
I would look at the different service lines. So the first section, you know, the sections are titled, and it will tell you what the big thing that is really, we really want everybody to understand is what is high fidelity wraparound and how does this process work? Because it's not just about the service you're providing when you're working directly with this youth, but it's a team-based, and being team-based is a critical part of a successful wraparound team and collaboration and things like that. And so it's really important that you kind of get that as a provider. And there's a lot more to it than just what happens between you and that youth or you and that caregiver when you're working with them. So we beg you to please read that part of the manual. And then when you can get down, there's a whole section in there about how to become a provider as well and what our standards are for that. And then towards the, I believe it starts with section 20, 21, 22, and 23 are the sections that discuss the services specifically. The wraparound facilitation and what it is. Now, to be a wraparound facilitation provider, you must be a nationally accredited agency. But for the services of habilitation and FST, you don't have to be accredited. You can just be an agency or an individual. And respite is the same. Accredited agencies can do all of the service lines, but you must be accredited to do wraparound facilitation. So I'm thinking most of you guys aren't, but for those of you who are, you could look at that service line too. After you review those service definitions and make sure you read on there, it'll tell you what the service is, how the service is supposed to be implemented, and who qualifies, what type of providers qualify to provide that service. So after you've reviewed those things, then if you have additional questions, feel free to shoot me an email and I would be happy to answer what questions I can for you.
Okay. They wanted to know, can you use your manual for the test?
Yes, you will be able to bring in your manual with you to the test. We find that people who print the manual do a better job than, they have an easier time, I should say, than those who come in with an electronic version.
Okay.
I just think it's easier for them to flip through it. But yeah, definitely. We wouldn't do that to you.
Okay, and then this is a clarification question. So the agency is not being approved as the CMHW provider, but the staff within the agency are being approved, correct?
They both are, but what happens is the approval for the agency flows up from the staff. So when you bring your agency with your staff is what authorizes your agency to appear on the PIC list. So as a group, so when you think about it as your Medicaid enrollment, you may have a group that has authorization to be a CMHW, but if you don't have an authorized staff person to provide the service, you're not going to be able to submit any billing.
Okay. And then someone said that the test has been happening in different cities recently, and where will the next test be held?
From now on, unless we have, with rare exceptions, from now on, it will be held at the downtown city office building, the government center, state office building, which is at 402 West Washington Street. So we're right down here in downtown. September, October, and November are occurring downtown. Like I said, we may not have events in December and January. It just depends on the number of resumes we have. If I've got quite a few people wanting to do it, we'll probably go ahead and have one in January. A lot of times people they're not really interested. We found that when we hold those trainings in December and January, we have a significant number of no-shows, which is part of why we want to do it at the state office building, because I don't care if only 3 people show up, we'll have it. We have had them in, I believe we went to Noblesville, West Lafayette, out in Eastern Indiana in Winchester, and we went down to Spencer County and Batesville. I think the Batesville one had to be canceled. So we've traveled around a little bit. I know a lot of people don't want to drive downtown into downtown traffic, find a place to park and all of that. And we're really sensitive to that. So as spring comes in, we'll probably start looking to hold those trainings at local libraries in the area, like Greenwood and Noblesville or Avon. And if we have enough people in a geographical location, we will come to that area. So if you've got Lake County, if you've got, 15, 20 people who are signed up to take the test, we'll come to you. If you have a whole agency of people that you want to put through that you think are qualified and you have, say, 15 of them, I'll come to your agency and administer the test there.
Okay. And then the next question is, how do you find out more about becoming a facility-based respite provider?
It's going to be in the manual.
Okay.
And also we have a facility-based respite form. It is a separate form on our website, on that provider website that I posted in the chat. So the 2 links I had, one was for the manual, which, by the way, will always take you to the most recent version of the manual. So save that link to your favorites, because when the manual is updated, that link will be updated. And then the second link was to the provider page where we have all of our forms, including the facility-based respite form. And that will tell you the types of licensure we accept. We don't license those facilities ourselves. We give you that deemed status from somebody else. So if you have emergency shelter care, a children's group home, licensed daycare, home daycare, those are types of licensure we accept for facility-based respite. For the home child care center and the home child care and child care centers, you can't have kids for the full 24 hours because of their licensure requirements. So if you wanted to do like afternoon and weekend respite, that would be a very easy license to get to become a provider, or so I hear. But emergency shelter care is the one that we see the most frequently for folks who want to provide facility-based respite. We're having a lot of success with that. The people who have done that it's turning into a great business for them. So when you look at that option, if you become an emergency shelter care, you have, let's say you have 6 beds or eight beds there, you don't have to share your billing for that. So the respite is one-to-one, the home and community-based respite, where you're picking up the youth and taking them from their home out for a few hours or for the day. You can only provide that service one-to-one unless there's more than one kid in that household on the CMHW program. And then you have to split the billing. So you're not getting paid any more for 2 as you do 1. But when you do facility-based respite, it's different. And so if you've got 6 youth with CMHW in the program, then you will be billing the daily amount for each and every one of those youth. And so then you're talking about being able to make some money. Then things are looking really good for you. And so we had one facility-based respite provider, Crossroad up in Allen County, who was constantly swamped and still are. Then since then, we've had 2 others become enrolled in providing services, and 1 who is in the process of getting their Medicaid enrollment completed. And they are doing great. They are busy all the time. They're having a lot of fun. They're making some money. If I left work today and went into the field, that's what I would do. I would do facility-based respite. I would open an emergency shelter care and do facility-based respite for the CMHW program.
Okay. Thank you. And then someone wanted to know, is there a test for adding respite or just other services?
There's no test for respite. You just watch the webinar and you'll print a certificate at the end of it. There's a link at the end of the webinar where you download a PDF and then you print it and sign it. And that is your attestation that you understood what was in the webinar, and that if you had questions, you know where to go for answers.
Okay. And then someone else asked, am I understanding that services provided through CMHW would not be affiliated with Choices?
That's correct. You would be enrolled as so Choices is a wraparound facilitation provider for the CMHW program. If you're going to have an FST, that's not a service that Choices provides on the CMHW. You would need to enroll or go to work for an agency who is a CMHW provider. And there are a lot of existing agencies out there who know what they're doing, who will help you through this process. And as someone, I was a provider for 25 years. You know, I've been a provider a lot longer than I've worked for the state. And I want to tell you, the percentage that the agencies take from your reimbursement is worth every penny, for it to be their headache to do the billing, their headache to monitor the supervision, and read all those Medicaid bulletins. So if you're an independent out there, I would strongly encourage you to look at agencies that are already providing CMHW services and consider working for them.
Okay.
It'd be a lot easier.
Okay. Then another question was, should providers request a test dates through the DMHA email?
So once your resume is approved, then I will send you an email letting you know that your resume has been approved, and letting you know, like right now, what it will say is, congratulations, your resume has been approved for you to take the test to be a HAB or FST provider. Here's our current dates of availability, September 20th, October 18th, right? And then you'll email back to me and let me know which one you want to attend.
Okay.
Then I'll send you an invitation for that one. So, but it starts with the resume.
Okay, thank you, Julie. And then some of the other questions I believe you already answered, or the answers are in the manual, like how you become accredited, and the question about do all staff for an agency have to have DMHA certification, or just staff that provide the service?
No, you don't have to. You don't have to authorize your staff who might still be doing work with, family preservation, for example. You know, if that's the kind of work you're doing, if you're, monitoring visitations or things like that, if you're not going to work in the CMHW program, those staff don't have to be authorized for the CMHW program. Just the staff who will be working with the CMHW program.
Okay.
Or if you want them to work for CMHI, they have to be authorized for the CMHW program.
Okay, and then the last question is, if you work with a provider already, do you have to retake the test to become your own provider?
Yes.
Okay. Okay, those are all the questions in the chat, Julie.
Okay, well, I hope everybody got what they needed. If you have follow-up questions, please send them to me. Your best bet is to send them to that DMHA Youth Services inbox for now. I look forward to reviewing your resumes.
Okay, well, thank you so much for your time, Julie, and everyone have a safe weekend, and we'll be in communication with you soon.
All right.
Thank you.
Could we also receive a copy, or I guess the copy of the recording for the video, or?
Sure, I can make that available. If you could put your agency or your email address in the chat, that would be helpful.
Okay, thank you so much.
All right, thanks everyone. Bye-bye.
Bye.